Which disease is also called lockjaw? The right option is option A, tetanus. Which infection is caused by Mycobacterium tuberculosis? The right option is option B, TB. Antidote of morphine poisoning is. The right option is option B, naloxone. Which lobe of brain controls vision? The right option is option D, occipital. The longest bone in the body is. The right option is option B, femur. Normal urine output per day in adults. The right option is option C, 800 to 2000 ml. Example of isotonic IV solution. The right option is option B, 0.9% NaCl. First sign of hypoxia is. The right option is option B, restlessness. Vidal test is used for diagnosis of. The right option is option C, typhoid. Which artery is palpated during CPR? The right option is option C, carotid. ECG P wave represents. The right option is option A, arterial depolarization. Normal duration of menstrual cycle is. The right option is option C, 28 days. Carrier of malaria parasite is. The right option is option C, Anopheles mosquito. What is the normal hematocrit for females? The right option is option C, 36 to 46%. Which is the largest gland in the body? The right option is option C, liver. First heart sound S1 is produced by closure of. The right option is option B, mitral and tricuspid valves. Deficiency of vitamin D causes. The right option is option B, rickets. Which is not a mode of transmission of hepatitis A? The right option is option C, blood transfusion. Which is a live attenuated vaccine? The right option is option A, BCG. The pacemaker of the heart is. The right option is Option C is a node. Normal range of serum potassium is, the right option is option B 3.5 to 5 mhsrb per L. Which vaccine is given at birth? The right option is option A OPV and BCG. Normal fasting blood sugar is, the right option is option B 70 to 110 mg per dl. Which vitamin prevents night blindness? The right option is option A vitamin A. The universal blood donor is, the right option is option C O negative. What is the normal heart rate in adults? The right option is option B 60 to 100 bpm. Antidote for heparin is, the right option is option B protamine sulfate, which is not a water soluble vitamin. The right option is option D vitamin B12. Which position is used for rectal examination? The right option is option B SAMS. Example of colloid solution. The right option is option C dextran. Glasgow Coma Scale maximum score is, the right option is option D 15. The causative agent of AIDS is, the right option is option C HIV. Deficiency of iodine causes, the right option is option C goiter. Which organ produces insulin? The right option is option B pancreas. Normal pH of blood is, the right option is option B 7.35 to 7.45. Normal respiratory rate for an adult is, the right option is option B 12 to 20 per minute.